So I'm pleased now to invite to the microphone Dr. Dewar, former Executive Director of Physicians for Global Survival. Dr. Dewar.
I think that's the right height for me. Thank you. Thank you for inviting me. I come from Treaty 4 territory, ancestral land of the Cree, Saulteaux, and Assiniboine. I'm also a rural family physician, which means that I am a Jack or Jill of all trades and a master of many. I set bones and I shock hearts. I do the same things that many emergency room doctors do in the urban setting. I became interested in this topic as a topic of health in the 1990s when I was working in northern Saskatchewan and had patients with renal failure secondary to uranium. That was because uranium is a heavy metal, not because it's radioactive. It also acts like estrogen in humans, and consequently we get diseases among men that we did not see previously in the north. We get lupus, for example, as one of the side effects. I think I've created this as ionizing radiation in health because I've spent the last 4 years reading just about everything I could on the topic, and I also registered to take a health physics course. Interestingly, the course was canceled only because there were not enough people interested in taking health physics at the university, and it was offered by the Department of Physics. In 2012, we received, when I was working as the executive director, we had so many questions about ionizing radiation in health as a result of the Fukushima accident that the assistant that I had working with me, Florian, said, why don't we put all the information that we're giving out into a book, which we did. And I've been since asked to update it, but I think that it'll be an entirely different book. I would like to call it Fraudulent and Forever, but Dr. Edwards tells me that the nuclear industry is so touchy about that I better be careful. So that way or that way? Okay. People were thrust into the side effects of ionizing radiation with the use of atomic bombs. This is a picture of the fallout from testing from the 1953 to 1970, covering the United States. The colors don't go past the 49th parallel, do not go into Ontario, as you can see, do not include Teeswater or Toronto, because Prime Minister Pierre Trudeau did not want to include them in the American testing. So we do not know how much fallout occurred north of 49 or the Great Lakes, etc. But as you can see, with the dark brown sections, that was the most fallout. And it goes all the way to virtually to the Canadian border. This caused an incredible increase in leukemias. And I think that it continued to cause the increase that the American Cancer Society in the 1970s called a cancer epidemic. They stopped using that term. This little slide is just of one person's, it's very poorly printed up, but Catherine Benke was a nurse doctor, a healthcare professional who was working in the area of the downwinder of the Trinity test. Now, the Trinity test of an atomic bomb occurred before they dropped the bombs on Hiroshima and Nagasaki. It was a test. It was a test to see if a plutonium bomb would actually work. Needless to say, it worked. But it also caused a mortality in newborns in the one county that Catherine Benke was watching. Catherine reported this to the Manhattan Project physicians and was told, "Oh no, that's not. You've just looked at your data incorrectly," and she was totally brushed off at the time. Another physician, no, a physicist, did a research looking at all of the births and the children that reached 1 year of age, going back from the 1930s until the end of the 1950s, and discovered that as long as they were doing atmospheric tests, there was a decrease in the number of children that reached their first birthday. He considered that there were 400,000 children missing through all of the testing years. His research was not printed in a normal research journal, but it was printed in Esquire under the title, "The Death of All Children," and you can look that one up. That really upset the Atomic Energy Commission in the United States, and they then went to find a doctor who would help them, make atomic energy good or nice, because they were hell-bent on having atomic bombs. In order to have atomic bombs, as President Macron of France said, you need atomic energy. Eisenhower knew that. He gave the famous speech in 1953 to the UN on the safe use of nuclear bombs for peaceful purposes. And shortly thereafter, the Atomic Energy Commission hired Dr. John Goffman, both a physicist, I think he's actually a chemist, PhD chemist and a medical doctor, to head their health division and health laboratory. But I'm going to go back a little bit in history and get those guys that Dr. Edwards mentioned at the beginning. Becquerel discovered natural radiation in 1896. But 3 months earlier, William Röntgen discovered X-rays. And I'm going to use X-rays a bit because X-rays are easy to measure. You know exactly how much you're giving someone. You can dial in the dose, and you get to see the image. So it's also then easy to measure the side effects of the X-rays, whereas it's much more difficult to sort out the side effects of gamma rays, which are the same as X-rays, maybe a little bit more excitable. And the one comes from the natural environment. X-rays can be turned off and on with a switch. So while gamma rays cannot be turned off, nor can beta or alpha rays. Can I turn this? Oh, I do this right. When Röntgen found his X-rays, he called them X-rays because X is the universal symbol for something you don't know what it is. And I'll want it back. And X-rays caused a revolution in medicine because now we could see the insides of people. We could see broken bones. We could see bullets that were lost inside of somebody. And doctors not only used it, but they used it a lot. And they used their hands to focus the X-rays, and they very quickly discovered a direct side effect of radiation was reddening of the skin and loss of the hair and peeling. But the tumors that they were focused on shrank. So that made them want to have more and more X-rays because therefore you could use them that way. In France, Marie Curie was busy taking uranium ore apart into its bits, discovering the polonium and the radium, as mentioned, and for her PhD. For her PhD, Lord Rutherford from the UK had come over to visit them at the time that she received her degree to pay honor to Madame Curie. And while they were having their very nice tea party in the Curie's rose garden, and this became dark outside, Pierre went and brought out a vial that contained radium. Now, radium oxidizes the air around it, turns it slightly blue, and it has a somewhat pulsating appearance to it. So everybody goes through the oohs and ahs of how beautiful this is. But Lord Rutherford notices in his journal that evening that Pierre Joliette Curie had the typical changes of one who worked with radiation. This is only 7 years after they've discovered it, and they already know that it's damaging. He already had seen enough of it that he could say the word typical of the radiation. Shortly thereafter, in fact, the next year, the assistant to Thomas Edison died of osteogenic sarcoma. Could you raise this just a bit? I feel like I'm trying to get into it. Thank you. That's better. And he was not alone, because there was an entire rash of doctors dying of osteogenic sarcoma. But there was money to be made in X-rays, and we all know we like money. The physicians with the X-ray machine would make more money, and many unscrupulous people did so. The excitement of seeing the insides of bodies, the ability to make diagnoses where none had existed before, attracted everybody, really, and it kept the medical profession absolutely tethered to the use of radiation until we've got ultrasound and magnetic resonance imaging, or MRIs, have come along where we can image without exposure to radiation. By 1928, it was possible to establish an international commission on radiation protection with a mission to protect people and animals and the environment from the harmful effects of ionizing radiation. The problem with the ICRP was that it was formed by the people who liked ionizing radiation, worked with ionizing radiation, and promoted ionizing radiation. So when they established the first safety level, they decided that the safety level would be that which, when you had your reddened skin, the redness went away. That was the safety level. They didn't know about all the things they couldn't see. X-rays were used so much that when I was when I was a student in medical school, we X-rayed everyone with when they came into the hospital. They had a chest X-ray. Some of you may remember getting chest X-rays when you went into the hospital. And that continued for a decade after I graduated. when I graduated in 1978, President Carter of the United States approved new guidelines for chest x-rays, limiting their use. And he said, radiation exposure could best be reduced by eliminating clinically unproductive x-rays and by ensuring good x-ray technique. He was probably the only president who was a nuclear engineer, and he was among the specialists that were called to Canada during the Chalk River meltdown in the early 1950s. X-rays and gamma rays are, for all intents and purposes, I'm going to repeat this again, are the same. So if X-rays cause cancer, so do gamma rays. Is there a safe level of exposure? Can I turn the slides back on? Yes, thank you. You got me right on the right spot. We evolved in and we live in a radioactive environment, from the potassium in our bananas, thanks for the question, to the radon in the air we breathe. We cannot escape. It's always with us. Does it in fact have an effect upon us? And this graph shows that it does. Just making sure it's on the left-hand side, you are seeing the little dots on the lines represent the children who are at age 16, have spent their first 16 years of life exposed to approximately 0.75 millisieverts. That's the low level. Then on the right side, you see the dots that represent the children at age 16 who have lived in an environment that's about 2.3 millisieverts. So we're talking low levels, but it's pretty easy to see that the right side has more tumors, cancers, and side effects from ionizing radiation than the left side, right? Do I need to explain that anymore? Nope, okay. So background radiation does have an effect upon us. Increasing background radiation will continue to have an increasing effect upon us. And we're not just talking about cancers. We're talking about autoimmune diseases, rheumatoid arthritis, diabetes, lupus, atherosclerosis, and heart disease. All of these have an increase in incidence upon exposure to background radiation and any radiation. In the United States, the Committee on the Biological Effects of Ionizing Radiation is a subcommittee of the U.S. National Research Council. Every once in a while, it publishes a report, seems to be somewhat irregular, but in 2007, their report, referred to as BEER 7, concluded that there is no level of radiation that a person could be exposed to that was guaranteed safe. In other words, every exposure increases our risk of developing cancer or one of the autoimmune diseases or having some sort of effect. How does ionizing radiation cause damage? It ionizes things. It's right in the name. It ionizes things. So if you ionize your enzymes, the cells of the walls of the cells in your body, they don't work right. They don't come back together in the same sort of form as they did before. If you ionize your RNA or your DNA, you change, perhaps permanently, the structure of the cell. And it can change regulatory systems in cells so that they don't know how to stop reproducing, giving us cancerous growth. Just got the 5 minutes, so I'm going to whip along to two other issues that come along, and that is that of effects upon the fetus. Studies were done in in and shortly after the Manhattan Project that gave radioactive iron to pregnant women at 28 weeks. Consider how egregious that is to start with, but it was even worse because the researchers did not go back and do their follow-up. So we would only know about these studies when the parents of those children sued the company that hired the researchers. So we wind up having a headline until we have a headline in the New York Times that says Vanderbilt sued on radiation. That's New York Times, February the 2nd, 1994. Now, genetic effects. We can't prove that there will be genetic effects from radiation in humans, but we do know that genes are affected. Researchers following Chernobyl's victims have found changes in the genome on particular sites. Now, the sites are really a ridiculous name, hypervariable tandem repeat mini satellite loci. How's that, right? But the fact that there are changes at all suggests that there may be more damaging being done. We do know that radiation on fruit flies does cause genetic damage. Herman Muller experimented with fruit flies, and in 1928 found those damages. Fruit flies have very, very big chromosomes. You didn't need an electron microscope to see them. And his result of his studies in the 1928 received a Nobel Prize, but he also became very fearful about what human beings were doing to themselves by the use of radiation. With his fruit flies, it took about 10,000 generations in order for the numbers of changes to create deformities that would cause a die-off. We've been talking about waste that will last more than 10,000 generations in humans. Mark it out, right? 10,000 generations in humans is going to be what? 120,000, 250,000 years. And we've got waste that's going to last longer than that. And I'm just going to close with a quote from Dr. John Goffman, the first department head of the Health Division of the U.S. Atomic Energy Commission, who got squeezed out of his job. I wonder why. Because his statement was, licensing a nuclear power plant is, in my view, licensing random, premeditated murder. It's premeditated because it is known what happens when a nuclear power plant is built. We know that we're building an industry where any release of radiation will increase cancer, and it is random because we don't know who will get it or even what type of radiation will cause it. This was and is not an industry with public health in mind. I'm just going to leave you with a very easy site. This is my blog spot, which contains a much, much longer version of what I said, and also all of the references that are contained in it. Did you want to ask a question? Do we have time? Okay. Right. Okay. I think so.
Thank you,
Great.
Dr. Dewar.